Pain can make life miserable for millions of people in the UK, with all too many struggling on without finding effective or easy to use treatment solutions. A new study commissioned by the pain experts at Mentholatum, the makers of Deep Relief, have exposed the daily difficulties and discomfort that being in frequent pain brings. 3/4 of us are in pain at least several times a month, more than half of us suffer a few times every week, and more than 1 in 4 of us suffer frequently during the day. The back seems to be the most common problem area when it comes to pain woes, followed by pains in the neck, shoulder, knee and leg. Worse still, the majority of sufferers said their pain could last for hours at a time, while a further 1 in 7 said the pain could last for weeks, and another 1 in 7 said that they suffered from pain all the time. Here to tell us more is Dr. Catherine Hood.
The effects of pain are often underestimated. Chronic or frequent pain can make life miserable for sufferers and result in limited or poor mobility, but also affect other parts of a person's quality of life, such as their sleep patterns, leaving people exhausted and short-tempered. Sadly, experiencing pain can also age people beyond their years and have a profound effect on relationships too, as it often affects a person's sex life. Some kinds of pain are caused by an injury or accident, so for example a strain or a sprain, and while this kind of pain is uncomfortable, it's often temporary. More chronic pain is caused by arthritis or back pain, and this usually persists for a longer time, and often there's no clear diagnosis or hope for improvement.
Daily pain, as we can see, is a common issue, and it would seem that back pain is the worst problem. Research shows that sitting hunched over a computer is a trigger for back pain problems, but this isn't the only catalyst. Other common triggers include sleeping awkwardly, using uncomfortable furniture, gardening, and driving or sitting in a car.
My back pain used to leave me tired, exhausted and irritable because I lost sleep. I used to have to take sick days off work and found it very hard to concentrate.
So how can you treat pain like back pain, for instance? Well, physiotherapist Sammy Margot has some suggestions.
Heat therapy is used in the post-injury recovery phase, which is normally 48 to 72 hours post-injury. The therapeutic benefits are that not only will it reduce inflammation, it will reduce joint stiffness and muscle spasm, as well as reduce pain. Cold therapy should be used immediately post-injury and up to 48 hours after injury.
Thanks, Sammy. So what products provide these types of hot and cold therapies? Well, Deep Heat is one great example of a hot therapy product. When applied to the skin, it dilates the blood vessels, so increasing blood flow in the affected area. The increased blood flow to the affected area provides proteins, nutrients and oxygen for better healing. When it comes to cold therapy, Deep Freeze is a popular choice. Deep Freeze helps the constriction of the blood vessels and helps stop the blood flow further into the injured area from the torn blood capillaries, whilst minimising further bruising and swelling. Like heat therapy, cold therapy also combats pain by competing with and disrupting the pain signals along the nerve pathway to the brain. Hot and cold therapies, as described by Sammy, are great news for temporary pain problems caused through injury, for instance. However, if you're a frequent sufferer of mild pain, then you possibly need to turn to another treatment option which works on both levels of the pain mechanism, inflammation and in interrupting pain signals. Deep Relief Gel does just this because it contains 2 active ingredients, ibuprofen, an NSAID and levomenthol. These ingredients have a powerful 2-way action to help reduce pain. Here to explain more is Dr. Catherine Hood.
First of all, it contains ibuprofen, which is a non-steroidal anti-inflammatory, so it reduces inflammation at the site of the injury, but also stops the production of prostaglandins, which are chemicals that are necessary for pain signal production. It also contains levomenthol, and this is a counter-irritant, reducing the number of pain signals that can get to the brain and hopefully reducing the amount of pain that you experience.
In more detail, all this means that Deep Relief Gel works on the inflammatory process of pain, and because it inhibits the COX pathway, it prevents the production of prostaglandins, helping to block the pain creation mechanism. Levomenthol stimulates the nerves that perceive cold, whilst depressing the nerves that perceive pain. When pain is felt, This means that pain signals have flooded the brain. But pain signals have to compete with other sensory signals such as cold and touch. If these signals are greater in intensity than the pain signals, less or no pain is felt. Leather menthol floods the sensory nerves with cold signals, diluting the number of pain signals, lessening the perception of pain. Deep Relief Gel is carefully formulated to help the effective delivery of its active ingredients through the skin to the tissues where damage has taken place, helping to relieve those pain niggles all without having to pop a pill. In summary then, there are 3 ways that pain, pending cause and length of suffering time can be eased, and it's advice that Laura has found very useful.
I suffer from shoulder pain, and it makes things difficult for me even to lift your arm just to get something from upper shelf at home. It makes it really awkward. It's constant nagging pain. I tried the gel and it soothes my pain a lot and I feel a lot better.